Hello, my name is Penny Eccles. I'm a physical therapist with Casa Colina in Pomona, California. And I'll be talking today about physical therapy management of lymphedema and lymphedema-related pain. Now, lymphedema, for just getting a common definition, lymphedema refers to swelling that occurs when there's been damage to the lymphatic system. In physical therapy, interventions can be used to address this swelling and the related complications. The lymphatic system is crucial to keeping your body healthy. It circulates protein-rich lymph fluid throughout your body, collecting bacteria and viruses and waste products. And it carries that fluid through the vessels into the lymph nodes, where the wastes are then filtered by lymphocytes, infection-fighting cells, and ultimately flushed from your body. Now, when that lymph system malfunctions, we end up getting signs and symptoms or complications. And that's when the swelling gets there. So some of those complications are swelling at the site of surgery or the surrounding area, a feeling of heaviness or tightness, restricted range of motion, pain, aching, or discomfort, recurrent infections, and hardening or thickening of the skin. So if you look at that list, somebody can kind of have some swelling just after surgery, but not really think it's going to add up to much. But then when it starts feeling like there's a heaviness or a tightness, like it's just a little hard to get that arm moved or the leg, you just can't quite lift it onto your chair. Those are things that kind of, when that complicates that swelling or compounds it. And that's a reason to get some therapy. Sometimes aching or discomfort happens before there's even some pain. But as soon as there's pain, there needs to be some therapy. And sometimes people even get recurring infections or cellulitis, which is just a reddening and an itchiness at that site. And a lot of times that's not looked at as lymphedema yet, but that is a sign that you need to get some lymphedema treatment. Then the hardening and thickening of the skin or fibrosis, it's like a callus that's being formed within the inside of your skin that's kind of doing on the inside what we a lot of times see on the outside. And it can end up causing cracks and areas for further infection. Now, these symptoms cause ongoing and increasing weakness or muscle imbalance, limited mobility in the affected limbs, and altered breathing. And those three things, the weakness, altered mobility, and the altered breathing, they're caused because of pain or scar tissue that forms, postural changes, lack of strength, and even mental stress because of having this thing happening to your body. It's kind of like your body is in a mutiny and it's kind of not doing what you want it to do, and that causes some added stress. So physical therapy addresses those factors that cause pain. We also address limited mobility, then muscular imbalances by using strength, stamina, and stability exercises. And then we also try to integrate what we do in physical therapy into a patient's daily routine. So why, besides those things, do we want to treat our lymphedema and edema? Because if we keep it there, if it stays there, there can be an increased infection, there can be actually some wounds that form, or the lymphedema itself can increase and cause even further problems. There can be scar tissue formation that is underlying the swelling, and we want to keep that from forming. Then there's impaired mobility, like we said, and then the fit of clothing. I was talking to somebody today, actually, who said, if you could invent clothing for lymphedema patients, you would be a millionaire. Maybe that's one thing that I should try to do. But then also aesthetics. That is, as long as we've got lymphedema on board, our body just doesn't feel good, then our life starts to not feel good. So treatment of lymphedema is a specialty within physical therapy. And it's called complete decongestive decongestive therapy. It's the gold standard for treating lymphedema. There's some clinics that say that they treat lymphedema, but if they don't have these different components, they're not really treating the whole case, and you'll end up not having a successful treatment. So what it includes is manual lymph drainage, compression bandaging, exercise, skin care, and patient education about risk reduction and self-care. In the next few slides, we're going to go over each one of these a little more in depth. So first, manual lymph drainage. It's the gentle personal massage that is taught. We start teaching at the second visit after the evaluation. And what that massage does is it facilitates the absorption of that lymphatic fluid from the interstitial spaces in your body. And it also facilitates the transport of that fluid in the lymphatic vessels. And then once we've got the lymphatic drainage done, we go to compression. And there's compression bandaging, like you see here, using short stretch bandages that we use. And as you can see, the toes and the fingers are all wrapped here. We try to have you wrapped from the very distal, from the furthest away from the heart, all the way up to the proximal, up to like the axilla or the groin. And that is to kind of try to get the fluid to move naturally as you're moving around with this wrap on. At times, this compression bandaging, it's done, we have to do it every single day. So sometimes we opt for a Velcro type wrapping or a Velcro garment that does the same thing, but that takes, we need to order that, and it has to be, I guess, specially made for you. So sometimes you'll start out with bandaging like this, but then transfer over to wraps. Then after we've gotten you down in size, we're able to put compression garments on, which are these lots of different things. The one that you'll see up in the upper left corner is a typical sleeve that we've all seen. But then if you go to the upper right corner, you'll see the one with the paisley on there. And there's some things out there that if you're going to have it long term, you can make it look like you've got tattoos or anything else on your arm, or even on your leg for that matter. Then there's compression garment classification. I almost didn't put this in here, but it kind of shows you that a lot of people, they've used those TED hose, which you get in the hospitals to prevent blood clots. And that's about up to 20 millimeters mercury. Then when we get into compression garments to get rid of your lymphedema, we kind of get into the 20 to 30 for your arms, 30 to 40 for your legs, and 40 to 50 can even be for total body or more compression for your body. Lighter compression, typically sold online, does not effectively address lymphedema. So do not go out and purchase a quote lymphedema stocking that you're getting offline that's probably 8 to 10 millimeters of mercury, because it's going to be just taking your money and not giving you an effective pressure. There's a reason the lymphedema products cost a little bit more, because they're specifically made for you and specifically made with the right millimeter mercury to actually get the compression so you can decrease the fluid in your limb. Then there's other compression garments. These can look almost like an oven mitt for your arm or your leg, but these have Velcro, and they're another way of being able to get the fluid moved without having the hard compression of the stockings. So we'll use these kind of wraps or Velcro garments during the day initially, but then we'll use them overnight to help that be a passive draining of the fluid. Then there's the compression pumps also. This is for if it's a very stubborn limb that doesn't get the fluid out of it very quickly or very effectively with manual lymph drainage and other compression, or if the person can't reach the end of their limb. Sometimes we'll add in a compression pump that is usually an hour a day, but it needs to be an hour every single day. And it can help move the fluid, but it's something that I don't really go towards very often. It's only in extreme cases that I'd like to prescribe that. And other tools that we've used is kinesio tape, which lifts the skin to allow the fluid to flow. And that's the kinesio tape is like the tape you see athletes wear. Like if you watch beach volleyball, a lot of times they'll have pink and green and blue on their backs and all that. That's kind of helping them be supported But what we found is that kinesio tape can actually lift the skin and allow the fluid to move up out of the area. And I've gotten some really good results with using that. And the K-tape can stay on for up to 6 days and then be removed, and something that you can learn yourself to take off. Then there's Lymphetouch, which is a negative pressure tool, kind of to work on the scars, but also to help get the fluid move in places that that it gets really congested sometimes, like in an armpit or right in the groin. Then after the manual lymph drainage and the compression, we've got lymphedema exercises. And I would not be a physical therapist if I didn't talk about exercises. So exercises facilitate transport of lymphatic fluid in the deep lymphatic vessels. So the manual lymph drainage is more superficial, so working from the outside in, where the lymphedema exercises kind of work from the inside out, getting the muscles to work and helps push the fluid down deeper into your system and hopefully get you to pee it out. Then after the exercises, we've got along the whole case of decongestive therapy is skincare. There's 3 C's that I like to say. We want to keep the skin clean using gentle soap. We want it coated with lotion, unperfumed, and we want to contain it. Make sure that it's contained, that the skin is intact. There are times when there are wounds and there's cracks and there's infections that we need to deal with, but we try to keep it, get the skin to a place that it's more intact, that we can actually get good compression and movement from there. We work closely with wound care in the hospital that I work at, and even within many of the insurance companies I work with, they've got their wound care that they work with also. But one of the primary impacts of chronic swelling, muscle imbalance, and malalignment is pain. And if I've got one thing that I wish I could get everybody out of, besides the swelling that is so big, is to actually get people out of pain. And so there are some things that we can do as physical therapists. Physical therapy interventions have little effect on pain that's caused by neuromas or radiation-induced plexopathy. And that would be if you've got a tumor that's resting on a nerve, or you've got the radiation that's actually fried the nerves of sort, and it's causing pain. There's not a lot we can do exactly to get rid of that pain, but we can deal with the tissues around it. So there are many interventions that relieve pain from other causes, such as the swelling that might be around where a neuroma is, or where the radiation has been impacting this body, or the scar tension. Physical therapy deals a lot with the scar formation and preventing that scarring binding down along a nerve that can cause a lot of lasting pain. And then muscle imbalance, we work on that to try to get the body working better with itself. And we also work on malalignment. Sometimes after surgeries, after we've had excisions of tumors or different aspects of our bodies, the malalignment of our joints can cause further pain. But if we just get that in the right order, we remove that pain. So those are a few things that we work on, and we'll talk about that further here. So the interventions that we'll use are positioning. We use relaxation and sleeping. I've actually took a course, a 3-day course on helping people figure out positioning and sleeping positions, which I can't imagine that anybody would think you'd have 3 days to talk about that. But it was very effective, and it's something that there's different things you can do to help people rest. And once we rest out of pain, we can actually kind of conquer it and not have it be the impacting factor throughout our days. Then there's scar treatment. We do a lot of myofascial release or strain counter strain, some types of trigger points I say later in the next one here. But we work at that scar. As soon as you have one point of a scar that's kind of binding down near a nerve or an area of surgery, we can actually get in there when it's healing to try to prevent the scar from binding things down further. And if we can get rid of that binding down, we get rid of the pain. Then there's trigger point treatment. That's kind of going into wherever a muscle is being made real tight and tense and figuring out how to just blast that out of there. It's kind of like it melts underneath your hands when we can get the right spot. Then there's mobilization. moving a limb, moving the body, trying to get away from the point of pain, but putting you into a place where you don't have pain and being able to work out from that. So mobilization works with that. And postural training, how to sit up straight. As soon as we have our bodies fixed in a place that doesn't allow you to get back into a normal position, you end up getting pain. And that's even in a normal body without lymphedema. We do a lot of postural training. Then there's meridian treatment, which is a bit of like a Chinese treatment of doing almost like an acupressure or an acupuncture. But it's kind of like seeing how different parts of the body, like say the foot, something happening at the foot might be impacting something happening at the hip or even up at the shoulder blade. And so figuring out what part of the body is connected to the other and making sure that that's in good health. And a lot of times that can get rid of the pain that seems unrelated, but that actually is causing you the pain. Then there's electrotherapy, like TENS units, muscle stimulation to just overcome any kind of pain. Of course, there's massage, the manual lymph drainage, which is personal massage, but then even just soft tissue massage that's not injuring the lymph system, but that's actually helping figure out how to relieve the underlying pain. Then we actually use a lot of aquatic therapy, which is called, like in one of the things we use is I Chi, which is Tai Chi in the water. So where I work at Casa Colina, we have a heated pool, and you can be a part of I Chi program that actually, that movement, if people have been a part of Tai Chi, which is useful with therapy too, as is yoga, as is Pilates, we kind of work with all those things. But I Chi in the water is even more helpful, something that I like to do just because I like being in the water and getting unweighted myself. So there you go with that management. Then physical therapy for lymphedema management. We want to get a referral for the lymphedema treatment from your medical provider. Find a lymphedema therapist that's a CLT certified, which is certified lymphedema therapist, and then come to therapy, 6 to 12 visits typically, and then you have to do the work. Then after we've had the physical therapy for treatment, after those 12 visits, we can't keep you forever. There's also a time for follow-up with the therapist if the compression garments stop controlling the swelling, if they're ready to be replaced, which happens within 6 months to a year sometimes. If they're really strong, needing to contain a lot, it might be 6 months, but sometimes we can make it a year before having to be recovered. And then if there's an exacerbation or an increase of the lymphedema, pain, or mobility issues that occur, those are all reasons to have further follow-up for therapy. Then resources for finding a therapist that's a CLT is the nortonschool.com. They have the listing of anybody that's been certified as a certified lymphedema therapist. Then there's the National Lymphedema Network, and they have position papers on all kinds of things like nutrition to when you travel, exercises, almost anything that you might have a question about. You could always get onto the network and see if they've got information or somebody that's kind of answered a question about that. There's Lymph Link magazine, say that a few times, where that just has information about lymphedema overall. There's annual conference, and then there's, I said, find a therapist, a clinic, and a support group. We don't have a support group yet. It's one it's in the making, I would say, but we've got several therapists at our clinic, and our clinic has a very active lymphedema population. And a place that has a population of lymphedema patients is a good sign that you'll have good quality care. Then there is, for garments, there is the Marilyn Westbrook Garment Fund. So if you find yourself unable to pay for things, it can be very costly to get these garments. This Westbrook Fund was founded to try to help people get those garments that are needed. Then there's lymphnet.inspire.com, and it's an online support community for patients, caregivers, and professionals to try to help get lymphedema cared for with our patients, but also care for those who are caring for those with lymphedema. Then if you have any questions, you can reach me at peckles@casacalina.org. I am on my computer every day, and hopefully I could get back to you as soon as possible.